bipolar disorder is a mood disorder, meaning that there's dysregulation in terms of controlling your mood, which then means that you either have very high moods or very low moods, so we call that manic episodes and depressive episodes. For most people, they think when someone says they are bipolar, it means they have two personalities. That's not the right, or rather, it's a misconception. Let me just put it that way. Correcting the misconceptions, I think, is just putting out the education out there and letting people know that this is a mood disorder. It can be managed with medication. So managing the condition, educating people about it, and letting them know that medication is not a bad thing. It actually is there to help in helping them be consistent. The early signs would manifest as changes in mood, where one notices that sometimes it can go for about 2 weeks feeling very sad for no particular reason, or maybe they have been triggered, yes, by something, but they're not able to get out of the low moods. Or if they experience very high moods, like they're very excited, it looks like it's not the usual, like someone who is high on something, but they've not really taken any drug, but they look very excited. And then again, there are some who have irritability. They're very irritable, and so they get into a lot of conflict with the people around them. But then again, it's good to mention that bipolar mood disorder has a very wide spectrum. There is what we call bipolar 1 mood disorder, bipolar 2 mood disorder, and other variants in between. So the mood really varies. Yes, those who get very high highs, and there are those who get what we call hypomanic episodes, and those now are categorized in bipolar 2 mood disorder. For family and friends, sometimes it's good for them to know that when somebody has an episode, they might not actually have the insight, we call it insight, or they might not be aware that they're unwell. So when they're able to pick the symptoms, then they can help their loved ones seek help early. I think it's just to reduce the stigma on mental health and be more supportive of people who are going through, even if it's a manic episode, a depressive episode, understanding that this is not a choice. Yes, there's some things they can do that are very, in quote unquote, annoying, but at the end of the day, if we are able to address those symptoms on time, then we have less friction and less conflict in relationships and less negative effects from the condition. And then again, for those who are going through the condition, not to self-stigmatize and seek help when they need it.